Hi there, my name is Dr. Angelika Dzieza, or Dr. D. I'm a periodontist at the Periodontics and Implant Dentistry of Tallahassee. I'm here to answer your questions about periodontitis. Periodontal disease is a multifactorial disease of the gums and bone around your teeth. The main cause of periodontal disease is bacteria. When bacteria sits within our gums for a long period of time, whether it's because we haven't seen a dentist in a while or haven't had a dental cleaning in a long time, or because we are missing some oral hygiene practices, over time that bacteria builds up and our bone around our teeth react to that, and therefore we lose bone around our teeth. The main symptoms of periodontal disease are very different from patient to patient. Some patients report that they don't feel periodontal disease, and that can be a concern because you sometimes cannot feel that is happening. Once periodontal disease becomes more severe, that's when patients tend to come to us with complaints of teeth that are moving or gums that may be sensitive or a little painful, and that's when we can help them figure out what stage or what severity of periodontal disease they have. Multiple diseases are connected and interlinked with periodontal disease. Our mouth is connected to our body and vice versa, so they have an impact on each other. Diabetes, for example, is one of those diseases that are connected, as well as cardiovascular disease. When I get asked the question if periodontal disease can be cured, I have to say no, not really. And the reason for that is once we lose bone around our teeth, it is very difficult, if not impossible, to gain back what we've already lost. However, we can definitely work our way to stabilizing that progression and keep things stable for the long term. In terms of treatment options for periodontal disease, we usually start with a very specialized cleaning. Sometimes we call this a deep cleaning. As we've talked about, the main cause of periodontal disease is bacteria. So our first premise and our first goal is to remove that bacteria from within your gums. Beyond that, there are other specialized, even potentially surgical procedures that we can do to combat periodontal disease. Periodontal treatment in itself shouldn't be painful because we're going to make sure that you're very comfortable during your procedure. I hope I've been able to answer some of your questions about periodontal disease. I would love to have a more in-depth conversation about your specific needs. If you're ready to call us and schedule an appointment, please call 850-692-9200.